Welcome to the Medicine Made Easy podcast, where we answer your medical questions. Now, here's your hosts, Sven Hosford and Dr. Chet Fox. Well, welcome to the very first episode of our new podcast, Medicine Made Easy. I'm Sven Hosford, and I'm here along with medical expert Dr. Chet Fox, who will be answering your questions about medical issues. Dr. Fox.
Oh, well, welcome, Sven. Thank you for having me. I'm excited to do this. I'm a I'm a professor emeritus at the University of Buffalo in family medicine. Big believer in we need to keep everybody healthy, and people need to understand what is happening to them. If they understand what's happening to them, not only do they make better patients. So the analogy I'll use here is it talked about the physician being the pilot and the patient being the co-pilot. That's not really the best image. The best image is the patient is the pilot. They fly the plane 24 hours. The doctor, like myself, or whoever your provider is the air traffic controller. We want to make sure you don't fly into the mountain.
Not flying into mountains is good. Well, it's going to make our podcast a little bit different is we're going to solicit questions from you, the audience. We're going to answer your questions. And to do that, we invite you to call or text 646-543-7836. And we'll have that number in our bio box there on the video and in the website. And you can just enter it in the website also.
Yeah.
So, Dr. Fox, give us a longer description about what this whole podcast is about. How did you first come up with the idea to do this?
Well, in my 40 plus year medical career as a family doctor, I found a lot of my time was just explaining to people what was going on in their body so they could make smart decisions about themselves. So, for example, they would go see a specialist, they would come back and have no clue as to what was going on. So said, what happened? Oh, the cardiologist said I had cardiomyopathy. And I go, okay, I can help you with that. Cardiomyopathy, cardio means heart, myo means muscle, pathy means weakness. So you have some heart muscle weakness that prevents you from pumping blood to the body. And when you can't pump blood to the body, it's sort of like the same as not having a sump pump for your basement. The the basement is the lungs, the heart is the pump. So when the heart can't pump, fluid builds up in the lungs. And if you have fluid in the lungs, it's sort of like drowning internally. You can't breathe. So that's why they give you fluid pills to help take care of that. So when I explain things to people that, oh, this is just heart muscle weakness, and then I would then talk about, well, here are some of the things that they can do about it. Here are the drugs that we have, and here are how the drugs work and why they work.
That sounds great. Now, who do you think overall, who are the kinds of people that will be helped by these answering these kinds of questions?
Well, two basic kinds of people, well, really three. Um, the first are the people who've seen their doctor, they've been told some things, and they have no idea what was said, so explaining what was said. Second is the current medical system is all about curing disease. It's not about preventing disease or keeping people healthy. Or is what I like to say, we have to move from a health care system, which is about curing disease, to a health system, which is about keeping people healthy. And we need to do that not only in the medical field, we need to incentivize doctors that, where they make more money keeping people healthy instead of making more money when the sicker the people are. In fact, I used to joke with my people who smoked. I said, oh, please go ahead, keep smoking. If you keep smoking, there'll be time, your lungs will get bad, you'll be in and out of the hospital, and I will make a fortune and I'll be able to send my kids to college.
Make that Beamer payment.
I've never been a Beamer kind of guy, but anyway. The,
Well, what kind of guests do you expect we'll have on the show?
well, it will be experts in uh, various areas. I think one of the first ones we will have is the head of the Andrew Weil Institute of Integrative Medicine. Andrew Weil was a Harvard professor who said, we need to do more than just Western medicine. We need to see all the good things that have happened also in Eastern medicine and in acupuncture and meditation and all these other things. And integrative medicine is really about keeping people healthy, but looking anywhere in the world for things that will help people, not just from Western medicine.
When I was in the Navy, we had a saying. It was use all the tools in the toolbox. And I think a lot of people believe that when you're just using pharmaceutical, you're only using one of the tools in the toolbox.
It's a
You know,
powerful tool, but it is limited. And also, I've had some experience with this as doctors got into their 50s and 60s. A lot of my friends in their 50s and 60s, they started saying, I've done all I can do with Western medicine. So they started looking at supplements and nutrition and exercise and meditation and acupuncture and other things in addition and became much more, uh, they didn't know what to call it then. So it became alternative medicine. Um, there was common medicine and alternative medicine. And now even the NIH has changed the name from National Center for Complementary and Alternative Medicine to National Center for Complementary and Integrative Health. So
right.
that fits. So one of our first guests, and we're excited to have him, is Dr. Dahmer, who's the new head of the Weil Center, who really explained about integrative medicine. Another guest that we're going to have, I can sum up a lot of bad things that happen in the body with two words. Inflammation kills. Inflammation causes cancer. Inflammation causes heart attacks. In fact, inflammation is such that even inflammation of the teeth cause heart attacks. So here's a tip for everyone, and the dentists are going to love me. Getting your teeth cleaned every 6 months reduces your chance of a heart attack. But we have medical insurance that doesn't routinely cover routine dental care. Some of the new Medicare Advantage plans do, but the typical medical insurance doesn't cover dental care. But dental care can prevent lots of things. No, inflammation causes cancer. Inflammation causes kidney disease. Inflammation causes heart attacks and strokes. So we're going to have an expert talk about how to deal with reducing inflammation in the body. And the other experts we're going to get are going to be based on what people, and I do think, I have a friend, he was one of my first residents when I taught at the university, and he went to the VA and he started the first uh, pain management clinic, multidisciplinary pain management clinic in the VA. And he became a licensed acupuncturist himself. Uh, Along those lines. It was so successful. That was in Buffalo that the VA now mandates pain management clinics. You can imagine all the problems the VA has, with
Oh, yeah.
pain management uh,
Yeah.
that 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 they have to deal with. But he was the one who pioneered that. He became a licensed acupuncturist. Then he got into auricular acupuncture. Um, the, it turns out that in the ear, there are spots where if you put the needles in, helps things. Now, I will tell another story here because we'll be telling a lot of stories. One of my first patients that used the auricular acupuncture, and this was now over 30 years ago. Guy was a 2 pack a day smoker, had bad kidney disease, and other things. And he said, should I do the auricular acupuncture? It was $100. So that's probably equivalent of $300 to $500 now, somewhere in that range. Um, And so it was pretty expensive to do that. He went for one session, he went from a 2 pack a day smoker to a zero. Never smoked from that day forward. Needless to say,
Wow.
his life got a lot better. But getting back to the auricular um, acupuncture and what happened that he found it worked. My friend, his name was Dr. Ramson here, found that it really helped people with migraine headaches.
Yeah.
Um, and I imagine one of the requests, if not, will be about how do I take care of migraine headaches? Because it is a huge problem with folks and not really well managed. And some of the newer medicines are better. But so he got into the auricular acupuncture. He had a neurologist that was a major skeptic, but after a while, a bunch of his patients uh, got better from their migraines. Now he refers all his migraine patients for the auricular acupuncture. So he converted a classic neurologist. Why? Because it worked.
Because it works. It's fantastic. Well, let's
I
talk
want to get
about.
back. Can I get back
Oh,
to?
oh,
I want to get back
good.
to one more thing on why we're doing this podcast.
Sure,
Yes,
sure.
it's uh, for the reasons we described, but also there was a great article, and I was going to look it up today, but didn't get to it. There was a great article in New England Journal. It was called Physicians and the Hanging of Crape. Hanging of crape was something that was done in the Middle Ages when a person was about to die,
Hmm.
so that they hung crape around the bed, you know, and they died within their bed. Um, so the he said, we physicians, we do the hanging of crape. We always give the worst prognosis. And we do that for two reasons. First reason is if I give a terrible prognosis and the patient dies, I'm a genius. And I give a terrible prognosis and the patient lives, I'm a superhero. And honestly, I read that article and I hated it. Yes, that works well for the doctor, but doesn't work well at all for the patient because
That's
it
right.
does the one thing that we should never do, and that's the taking away of hope.
Mm. Wow.
Um, so it's very important. So I said, look, I will be honest with you, but if there's a reason to be hopeful, I will give you that reason. So,
Yeah.
so I'll give you another example. People would talk to me and they would say, how long have I got, doc? They had cancer or something else. And they said, I never give a number. And here's why. When I was first in practice, I was a rural doctor in a small town. And the I can't tell you, I must have had at least a half dozen to a dozen patients tell me, oh, the doctor told me years ago I had 6 months to live. He's dead. I'm talking to you.
I have met a lot of the people like that as well.
So, so that told me it was not good to do that. And honestly, I do think a lot of that is hope. The mind body and the person who really believes they can do something can do it. The person who really believes they're going to. The other thing is that uh when I was in medical school, that was before, that was when Elizabeth Kubler-Ross wrote the book on death and dying, you know,
Mm.
where she talked about how it's important to talk to people about um, their dying and stuff and everything else. So it became, you had to be, quote, honest with the patient about what they were doing. Before that, you wouldn't say anything. The doctor never talked to the patient about them dying. They would whisper outside to the family or other things, but you never talked to the patient about it. So that was a transition in how we practice. Well, one of the first person I went to had a brain tumor. When I told him he had a brain tumor and that it wasn't good. He went into a terrible, morbid depression and died shortly after. I said, well, that's tough. Should I have told him, not told him? But I go, can't take away hope. That taught me that you, even if it's brain cancer, because, miracles happen, but there's I think um, the person who does the medical commentary on Fox News is from NYU, and he wrote Miracles Among Us, where the power of prayer, meditation, other things cannot be underestimated. In fact, the studies on prayer are really interesting. Um, there was this double-blind study that the doctors didn't know who the patients were praying for. The patients, you know, so the patient didn't know they were being prayed for. The doctors didn't know who was prayed for. So it was a double-blind study. So they had patients randomly assigned to being prayed for remotely, miles away, remotely. And the patients, and these were people in the ICU, and the people who were prayed for did better than the people who weren't prayed for.
Certainly. Well,
Yeah.
there's an old saying that says, nobody is born with an expiration date. I think I heard that from a doctor at one point, so there's nobody but the creator that's going to say when we're going to check out. But also there's a lot of new science about how the positive mindset is actually helps to regenerate cells within the body. Um, Bruce Lipton wrote a book called The Biology of Belief, and he proved that your body, the cells of your body, listen to your self-talk. And the more you are optimistic and the more positive you are, the better the outcome is going to be. And you can actually heal yourself with positive self-talk. So, yeah, I would think not taking away hope is one of the best things you can do as a doctor.
Well, yeah, I I have a saying, and my brother helped modify it. He says, the person who believes they can and the person who believes they can are probably both right. And
Right.
my brother modified that and said, the person who believes they can and the person who believes they can't are both right.
Are both right. I think Henry Ford actually said that, the great industrialist. Well, we've talked about kind of what the themes are and so forth, but let's um, let's see if we can give some specifics about the kinds of questions that we'll ask and will be answered. Did you have any that come to mind right away of the kinds of questions that you want to have to be able to answer? Some
Uh,
sample questions.
well, like I said, the chronic pain is certainly going to be one that we need to talk about. You know, um, migraine headaches, people with breathing issues, chronic lung disease, people with, and one of the things that I'm intensely interested in, I think will be one of our first podcasts, how to prevent or maybe even reverse chronic kidney disease. Uh,
Kidney disease. Yeah.
so it'll be the common diseases. We probably will get questions about diabetes and nutrition, and that's on the disease side. But then want to talk on the prevention side, like we're going to have integrative medicine, what integrative medicine is, how it works, and similar to that is the idea of functional medicine. How do we keep ourselves uh, healthy? So experts in these kinds of areas, and we really do want it to be. Um, I don't like the term patient, but let's use it for, patient driven. But I haven't figured out a good substitute for patient. I don't like the term client either.
Well, yeah, I liked your metaphor of the patient is the pilot of the aircraft,
Yeah.
and I think the best thing we can do is to help um, people understand how to become a pilot of their own, how to become responsible for their own health, how to answer questions for themselves. And I want to talk about this first case where you actually answered a question for me that was very helpful. And it's again, it was so easy, and the answer was so easy. I think it's worth talking about. If you remember, I was suffering from well, I had quit drinking for a couple of months, and I'd lost 25 pounds. And then suddenly I was getting these swollen ankles. Like my ankles would swell up and they were itchy and a little painful. And I went to a cardiologist, and he didn't say anything about it. He said, well, let's do some more tests. And I told him what I was taking blood pressure medicines, and I told him what blood pressure meant. And then his best suggestion was, let's take some more tests. So I talked to you about it, and your first response was, well, you asked me what meds I was taking, and I told you amlodipine. And you said, well, amlodipine causes swollen ankles in 10 to 15% of the people that take it. So I stopped taking amlodipine, and what do you know? The very next day, my ankles were fine and have been fine since. So side effects and this whole issue about who should know them, who should say them. What can you say about that?
Well, I think you phrased it very well. The more the patient, now, without going into the problem with the pharmacists and the literature and all that stuff is because we're in a litigious society and regulations that if a side effect is one in 10,000, it's there. It's written there.
It's listed
And
in the, yeah,
yeah. And if you list the possible side effects, the placebo effect creates side effects. So, so if people worry about the side effects, they get side effects. So when the pharmacist has that, and here are the potential side effects, they don't do, that if they were going to do it properly, they should do it by percentage. This is
sure.
10%. This is 3%. Or here are all the side effects that are in more than 5%. Here are the rest of the side effects. Um, Ideally, I would like, instead of looking, well, and this was true in drug interactions and other things, the you shouldn't have pharmacists alone just making the recommendations. Pharmacists don't treat patients. So the pharmacists need to work with medical experts to decide what is clinically significant for this individual. But the fear of lawsuits means that anything that could possibly be there. So, for example, Ozempic, the famous, has a 1 in 10,000 side effect of pancreatitis, severe abdominal pain. And a, a percentage of those with pancreatitis, so a smaller percentage, end up with pancreatic cancer. So if it's not labeled, you taking Ozempic, you might get pancreatic cancer, and a patient gets pancreatic cancer, they could sue the doctor and whatever and win. Why didn't you warn me that I could get pancreatic cancer? So the pharmacist labels it. Uh, it's up to us, but it's not labeled 1 in 10,000 pancreatic cancer. Then the person can decide, well, my chance of 1 in 100 of dying of a heart attack, 1 in 10,000 of pancreatic cancer, this reduces it. So everything in medicine is not absolute. It's all risk benefit. I'll give another example of that affected my brother, where the doctors didn't really know the side effects of what was going on. I'd like to be the hero of this story, but I'm not. He did this himself. It turns out he started to get severe severe kidney disease, and he was in and out of the hospital. And his kidney function, the test is EGFR, estimated glomerular filtration rate, dropped down to 14%, 14, which is pretty close to needing dialysis. And someone looked up, or I looked up, or yeah, I don't think I did, but he found out that his drug, Prilosec, which is now omeprazole, can cause interstitial nephritis in a certain percentage of people. You know, and it and honestly, it wasn't even in the package insert. Yeah. So that's why he's part of a class action lawsuit going on 8 years now. I mean, these things. Um, but he stopped that, and his kidney function, it hasn't returned to fully normal, but he's just at the border of stage 2 and stage 3 chronic kidney disease. He's gone from 14 to the low 60s, high 50s. Um, but that was preventable with knowing that that was a potential side effect. And omeprazole is now given out like candy at the hospitals. It's even over the counter. Um, Almost every patient I have coming from the hospital to the nursing home where I work now um, is on omeprazole, and they label it GERD, and they may or may not have it. Um, yeah, don't
But the point
don't.
is, if you are experiencing some sort of uh, what you think might be side effects, it's really the responsibility of the pilot of the aircraft here, us, to go and do a little bit of research and just to find out, well, maybe my doctor didn't tell me about this. Maybe this is a side effect of one of the drugs I'm taking.
Not interesting along those same lines that part of the research I did was on chronic kidney disease. I ended up being my career evolved. First, I was a rural family doc, solo family doc in a small town. Um, then I went into academic medicine. When I went into academic medicine, I taught for a while. Then I got curious about questions, so I became a researcher. And one of the things that we did research on was called medical errors. There was a big thing in the late 90s by Don Berwick on it was called To Err, to err is human, and that basically this was the late 90s and the figure was 98,000 people a year, and you talk about the fentanyl crisis, died from medical errors. Yeah.
Oh, yeah.
you know, yeah. If it wasn't for the fact that it was medicines and pharmaceuticals, that would be called an epidemic. But
Yeah.
it wasn't. So his father was a civil engineer, and we did research on uh, medical errors. We have about 3 or 4 published papers, maybe more than that now, published papers on it. But the theme of it was the patient that was actively involved in their care had way fewer medical errors than the patient who just did whatever the doctor said. And this was based on the success in airline safety. What they found in planes crashing was that if the pilot just took an authoritarian approach and didn't listen to any of his teammates, more planes crashed. If they let anyone stop the plane if they thought there was a problem, plane crashes disappeared. And basically, we have very few plane crashes in the country because anyone from the maintenance worker to the janitor to the stewardess can stop the plane and say, there might be a red light flashing in the cockpit and the pilot doesn't see it.
Well, let me get back to another thing that happened with me and how you helped me was then a second kind of round of side effects happened where I started to get dizzy all the time. And you were able to help me figure out that it was two of the other blood pressure medicines that I was taking. And I cut back on those and my dizziness went away. Well, not until I fell and bruised my ribs and walked around with sore ribs for a month. So talk about the importance of paying very careful attention to your dosage when you have a big weight loss like that.
Well, you just said it. I don't have to tell them. You just did. Uh, that
But you're the color commentator, so I'm expecting you more color here.
change in body weight, affects dosage needed for medicine. The so what, and this would be more, there's you, but people who go on Mounjaro, Ozempic, or have bariatric surgery who lose 100 pounds need to be very careful about, you know, they don't need as much medicine for their blood pressure and stuff. And there are other simple things that are really important. We probably should talk about sleep and sleep medicine sometime.
Oh, sure, yeah,
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 but the health value of sleep cannot be underestimated. But there's then a very common thing, especially in obese people like myself, which is sleep apnea.
sleep apnea.
Which basically the long and the short of it, we should have someone on sleep apnea. But basically, if you're snoring, there's a good chance you have sleep apnea. Well, I snore, overweight, diabetic, the whole 9 yards. And I said, I don't want to go on the machine. From the time I went on the machine, I used to get drowsy at 3 o'clock in the afternoon. And they said, oh, I'm a doctor. It's stress. It's late in the day. That's what's causing it. Well, once I went on my sleep apnea machine, that markedly improved. I didn't I didn't need that. So we definitely should have someone really talk about sleep, the importance of sleep, diagnosis of sleep apnea, and other things.
Yeah, that's great. Well, let's wrap this up. I think we've done a pretty good job on describing why we're doing this, and what kind of issues and things we can talk about. And again, if you want to reach us, just go to our website, we're not Health Defender, we're medicinemade-easy.care. And the number, if you want to use that, is 646-543-7836. Dr. Fox,
I really want to encourage people, that we really want this to be about you, because think about it. If you're having the issue, there are probably hundreds or even thousands of people who are having the same issue and are not having it spoken about. So, and that's a lot why we're doing this. We want it to be about things that are important for your health and for you improving your health.
Yeah.
Back to you, Sven.
Yeah, couldn't have said it better. Well, you did say it best. So that's it. That concludes this initial podcast of Medicine Made Easy. We'll see you next time. You've been listening to the Medicine Made Easy podcast, produced by Medicine Made Easy Productions. Please send us your questions via the link at medicinemade-easy.care or call or text 646-543-7836. Your questions will determine what topics we'll cover and which experts we'll get to answer your questions.